Keeping clinicians in research, the CREST strategy 2006 to 2012, is a 7-year review of the clinical research reproductive scientist training program. There are currently many obstacles facing clinicians today that has led to a decline in the number of clinicians involved in clinical research. One proposed cause of this decline is that physicians have a limited experience during early medical training and in residency in substantive research time. In response to this need, the Clinical Research Reproductive Scientist Training Program, or CREST, was developed to provide additional training and mentorship to practicing physicians in reproductive medicine. The program was sponsored and started by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, the NICHD, the Clinical Research Training Program, CRTP, at Duke University, and the American Society for Reproductive Medicine, ASRM. This joint program helped to provide additional methodologic and quantitative training in clinical research. The CREST program is open to all physician members of ASRM, and our 7-year review between 2006 to 2012 sought to evaluate the productivity of CREST graduates following participation in this program. The program involves a 1-year online didactic classes in the quantitative methods in clinical research through the CRTP. There are intensive weekend seminars at the NIH as well as CREST sessions at the annual ASRM meeting. Between 2006 and 2012, there were 33 physicians that completed the program, and these included reproductive endocrinologists, urologists, and general obstetrician gynecologists. One of the measures of productivity that we looked at was the publication number prior to CREST participation and following CREST participation. In the year prior to participation in CREST, there was a total of 65 published reports in PubMed compared to 81 total published reports in PubMed following the participation in the program. One other method of looking at productivity was collaboration. In 2010, there was a formalized collaboration between the Reproductive Medicine Network, the RMN, and the CREST program. And this helped to further collaborative opportunities and mentorship. One other type of collaboration occurred between the CREST participants in 2006. The charter class published a study together along with the Society for Assisted Reproductive Technology, SART. They evaluated the SART database to look at predictive factors for pregnancy and pregnancy loss. In 2010, following the formal collaboration with the RMN, CREST investigators actively participated and recruited patients for 4 clinical trials and 1 pregnancy registry. In fact, this involvement of the CREST investigators helped enable the timely completion of these trials. And lastly, 23 of the 33 participants are currently mentoring more junior investigators, medical students, residents, and doctoral students. In 2012, an independent review of the CREST program showed that 85% of its participants reported that having been a part of this program helped to further their career and professional development, and 77% of participants reported that they are actively engaged in collaborative research with other investigators. Expanding the number of new investigators has been a priority for the NICHD and other NIH institutes. The CREST program has demonstrated effectiveness at keeping clinicians in reproductive medicine engaged in clinical research. Our review of the 7 years of experience of the CREST program illustrates one model that has been effective at curtailing the problem of the decreased physician-scientist pipeline. I'd like to thank my co-authors and collaborators on this review, Drs. Maddox, DeCherney, Rebar, Alvero, and Armstrong, as well as the NICHD ASRM, and the CRTP at Duke University for the continued support of the CREST program.